So now we look at one very, very important parameter in diagnosis of diabetes mellitus, and that is the glycated hemoglobin. I mentioned earlier in the previous lecture that glycated hemoglobin is a very vital tool in the diagnosis of diabetes mellitus. Now, glycated hemoglobin is also known as, some people call it glycated, some people call it glycohemoglobin, some people call it glycosylated hemoglobin, and then it's generally referred to as HBA1C, HBA1C or hemoglobin A1C. Now, this is a hemoglobin molecule that is chemically linked to a sugar. A hemoglobin molecule that is chemically linked to a sugar, particularly glucose. So, this glycated hemoglobin is formed when a ketoamine reaction occurs between glucose and the N-terminal of the amino acid molecule. And now, this attachment usually takes place at the beta chain of the hemoglobin. So the N-terminal of the beta chain, the N-terminal amino acid of the beta chain of the hemoglobin molecule. So now that glucose that is linked to it, when glucose is now linked to it, that is known as glycated hemoglobin. Now, glycated hemoglobin is used to diagnose, to observe how the body of the individual has managed glucose in approximately the last 3 months. Now, why is that? Because you know that the red blood cell lifespan is 120 days, and you know that hemoglobin is located inside of the red blood cells. So for a red blood cell, between when a red blood cell is formed and when it is aged and destroyed, is on the average of 120 days. So give and take, removing 1 month from it, considering the fact that there are some red blood cells that would have been there a month before the glucose became linked to it and all that. So we use it, just say on the average of 3 months. In the last 3 months, let's see how the body has managed glucose. And one thing about this glucose that is linked to hemoglobin, it does not detach. It does not detach on its own until the hemoglobin until the red blood cell is destroyed and the hemoglobin is now broken down. That's when it detaches. So that means once the glucose attaches into the hemoglobin, as long as the hemoglobin is active and viable in the blood, the glucose will remain attached to it. So it is not affected by maybe medication, or you say you took the medicine for diabetic control, for glucose control, and then the medicine destroyed the glycated hemoglobin. No. So now what this means is that if an individual appears and you do a fasting blood glucose in that individual and do a glycated hemoglobin in that individual, it is possible for fasting blood glucose to be high in that individual and glycated hemoglobin is normal. Now, what that simply explains is that if that person at that point that has the high blood glucose, that high blood glucose may have occurred as a result of maybe what the person has consumed in the last 24 to 48 hours, right? Now, that doesn't show how the body has been managing glucose in the last 3 months. So that means the person may have had a proper glucose control in the last 3 months, or maybe just a few days, 1 or 2 days before the person appeared at clinic or before the sample was collected for fasting blood glucose. The body may have not managed the glucose properly. The person may have not taken or consumed the, the anti-diabetic medication that is supposed to have taken, or may have not watched diet or watched what he has eaten. So, so that means that glycated hemoglobin gives you a long-term retrospective glucose control information. That's what it means. So it is also possible that somebody who appears now and is having a normal blood glucose, the glucose is not high, glycated hemoglobin is high. Now that tells you that within few the few period, maybe 1 or 2 days before that sample was collected and the glucose is appearing normal, the person may have kept to the rules, may have followed precautions, but months before then, the person may not have followed precautions. So that's why glycated hemoglobin is a very significant and very important parameter in diagnosis and in management of diabetes mellitus. So it's not only used for diagnosis, it can be used as a follow-up tool. For example, for patients who visit their clinics regularly, for diabetic who are already diabetic and they visit the diabetic clinic regularly, what happens is that as they come, every time they come, every 3 months as they come for their clinic, the doctor will always request, in addition to other investigations that they will do, there will always be a glycated hemoglobin request to know whether the person is actually following instruction or taking the right precautions. And to also, it's an important tool to know whether one, if the person's diet should be adjusted, or if the medication the person is already on should be adjusted or not, whether to add to it or to remove from it. But it's a tool not only useful for diagnosis, but it's also useful for management of glucose. Now, glycated hemoglobin, when it's high in circulation, it causes an increase of free radicals inside the blood cells. And then these free radicals alter cell membrane properties, and that will now result in blood cell aggregation and it will increase blood viscosity. And this one can result in impaired blood flow. So it's not only that it is just there to 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 be used as a diagnostic tool, it also has its negative impact on the individual. So as much as possible, even though it's useful for the doctor or for the physician managing a particular patient to be able to know how well the glucose of the individual is being managed. If it is high, it can result in generation of free radicals that can cause blood cells to aggregate together, thereby making the blood to be very viscous, and that can affect blood flow. You know, the more viscous the blood is, the reduced the more the reduction in the rate of blood flow. And you know that when there's a reduction in the rate of blood flow, it has its impact on the heart function. So you see that glycated hemoglobin that is high is associated with heart function. It can affect or hinder the proper functioning of the heart as well. Now, glycated hemoglobin for an individual who is not diabetic is less than 5.7%. Now, for individual who is diabetic or who is having impaired glucose tolerance, glycated hemoglobin level falls between 5.7 and 6.4. And then for diabetic individuals, their their um, glycated hemoglobin level is greater than 6.4 or greater than or equal to 6.5. So that means 6.5 and above is diagnostic of glycated of diabetes mellitus.